Good morning and welcome back. You're tuned to Radio Now 95.3 FM Lagos. This is the interview on Now Breakfast. And this morning, Abuja has been uncovered as the center of illegal kidney trade in the country. A Daily Trust report. This is Daily Trust. They carried out a covert 3-month-long investigation into the dirty trade involving hospitals in Abuja and brokers who lured young Nigerians into donating their kidneys for as low as 1 million naira. Here is one of the victims that was interviewed by Daily Trust as originally aired on Trust TV.
Window for Ben Albert Niger. So Habib come and tell me say that okay, let's talk. Habib we go out and talk. He told me that there is one business for town inside Abuja. They do kidney harvesting. So I want to tell and say they will carry my kidney, go outside country, I will how. Say no, and me and the person will get kidney problem. We do tests. If we do okay, then they will give me 1.1. I told him that his money is too small. Out of 2 million, God was saying no. Say they will give me 1.1. We talk. Don't tell me say okay, they will give me 1.2.
Abbas is one of at least 6 young men from Mararaba that have followed this dangerous path.
The voice you just heard is the voice of Lami Sadiq, who led the investigation, the Daily Trust investigation into the matter. It also goes on to reveal how a lack of government policy and guidelines for hospitals involved in organ transplant is fueling this crisis. This morning, Ms. Lami Sadiq, the investigation's head at Daily Trust newspaper, joins us in the conversation. Good morning and welcome, Ms. Sadiq. It's a pleasure to have you on.
Good morning. I'm really happy to be here.
So let's start off with, before we get into the investigation proper, just what exactly led you to embark on this journey?
Okay, thank you so much for your question. Actually, this is a journey that started sometime around July. We have already published the first story sometime in August. It started around July when we got a tip that a young boy, a minor's kidney had been harvested and his father was willing to talk. And so we got this report through a group of lawyers. And so, of course, after discussing with them, they agreed to visit us in our office. We spoke with them. And then, so, of course, we started this investigation. It started with just one person, a minor, and we dug deep and we were able to publish the first story sometime in August. But after that story, we started to get more calls, and people were telling us that this actually goes beyond what we have reported. There are other victims, that it's actually a chain, that there's a chain of agents and kidney brokers, actually. And Mararaba, Masaka, the outskirts of Abuja, these satellite communities are almost like the market where people go there to get victims. And so, of course, we started to dig. And luckily for us, people were willing to talk to us. And then after that, we decided, okay, we've gotten a lot of testimonies from these young men, because all of them were below the age of 25. We've gotten a lot of testimonies from them. We've done a lot of research. We decided, okay, the best thing is to go undercover and see what these people telling us is actually true. Is this actually what we will find when we go undercover? And incidentally, it was what we found. The only difference was that because of the time span, some of the donors, I say donors in quote, because it's illegal to buy kidneys, were saying that, oh, well, things have changed. The cost of living is quite high now. So, of course, the price of kidney has now gone up. It should now be 1.5 million. So that was what led to it.
Lami, could you give us a further sense of your findings during the course of the undercover period of the investigation?
I think what we're seeing is that mostly what we found is that the target is people from low economic background, people who live in poverty, people who feel 1 million naira is big enough to change their lives, people who think that it is within their rights to sell their body, people who do not even know that it is illegal to sell their kidneys, people who do not even know the long-term implication of selling their kidney. So these are some of the findings. We found that socioeconomic situation in the country is actually fueling this trade. What we found is that also there's a likelihood that, because one of the victims told us that he sold his own kidney to a foreigner. So I think the question I think we need to start to ask is, we should dig to find out why are foreigners coming to Nigeria for kidney transplantation, especially people coming from North America, people coming from India. I'm saying this because we know that healthcare system is more advanced in those countries. Why are they coming to Nigeria for kidney transplantation? We need to ask these questions. It's possible they're coming here because they know that it's easy to access kidney with poverty, and they can easily use brokers to get young boys from Nigeria to give them a kidney at very, very low prices.
So I do wonder if you found out how much in a legal in a legal setting, right? How much would typically be involved in a kidney transplant? You already mentioned that I think all countries across the world, except is it Iran, where it is illegal to trade in organs, but there is still a price for the surgery itself and other things that would typically go into it. What is that disparity? Could you speak to us on that?
What we found is that for Nigeria, so that's government hospitals that offer transplantation, what we found is sometime in August is that to offer a transplantation that's medically, as it is safely and legally, I think you pay between 5 million naira for the procedure. But in private hospitals, people who have had kidney transplantation pay as much as 10 million to 15 million. That's for the procedure. But legally, organ donation should be altruistic. You should do it for humanity. You shouldn't sell your kidney. It should be altruistic. So, but in Nigeria, of course, we don't have a list. We don't really have a regulatory agency that has drawn up a list of people who need organ transplantation and what is the process. Another thing is that in Nigeria, we do not have cadaveric organ transplantation, meaning that people deceased organ transplantation, maybe donating a kidney after someone is dead. We don't really have that due to possibly because of our cultural and religious background. But if you check in advanced countries, the high number of organ transplantation comes from deceased transplantation. So of course, we have desperation fueling this because people who need kidney are desperate because they want to prolong their life. And sometimes people don't want to use relatives because of the risk. So they prefer to just buy a kidney in the black market.
Ms. Sadiq, you yourself went on the cover. What struck you the most about this experience?
I think what struck me the most is the fact that even the agents are young boys. That kind of scared me because, and you find that except for the agent we spoke with while on the cover, most of the agents, from the testimonies we gathered, most of the agents have equally sold their kidneys because it's easy for someone who has sold his kidney to convince another person to do that. So when the agents meet these young boys, they tell them, well, I've sold my kidney and I'm fine. I have a scar to prove it. And then they show them the scar and they tell them, well, I'm fine, right? And then so it's easy to convince another person, seeing that scar, seeing that you are fine, easy to convince the person to also do that. So what kind of struck me is the fact that these are young boys playing a dangerous game and they do not understand the implication. They do not understand the long-term repercussion of what they have done. But then again, these are young boys telling me now, months after their surgery, that they go through a lot. There's a lot of pain. They no longer have the physical strength they used to have before the surgery. So we are seeing a lot of regrets. And if we're not careful, like one of the experts said, one of the the outcome of this is that over time they may get depressed. And we saw that in one of the victims we spoke with. He almost became suicidal. He attempted suicide because he felt he had lost a lot. He had given out a kidney. He no longer has the strength to do certain jobs. He is not unemployed. And then again, to crown it all, the 1 million naira he was given, half of that money took from him.
I mean, you paint a very grim picture, and we know that typically when an organ transplant takes place, there's the long-term care that happens after. This also speaks to the responsibility of the hospitals themselves who are involved in this. And in your report, you repeatedly name one hospital that seems to come back to the center of this illegal trade. Is it just one hospital that's in the mix, or are there a number of hospitals in Abuja that you have found to be culpable?
Actually, in the course of our investigation, we found young guys who said it is not just this one hospital, but of course, we're working with the evidence we had. There are other private hospitals. That is what we're calling on government to beam a searchlight on not just government hospitals, but also private hospitals. Because you find that when it comes to kidney transplantation, private hospitals are championing this cause. It's a good thing. Yes, we want to see this kind of advancement in medical care in Nigeria. We know that the private hospitals are pumping a lot of money, so they have equipment, they have the resources to pay qualified staff. So it's a good thing. But all we're asking is that government beams a searchlight, because again, if care is not taken, private hospitals may be driven by profit to make money. And so perhaps if we are not careful, ethical and legal lines will be crossed. So, of course, there are other private hospitals who are doing this. And their private hospital, why we need to ask questions why private hospitals have very high number of kidney transplantation. Where are they sourcing these kidneys? Although private hospitals will tell you that we do not source kidneys, we don't know anything about that. The recipients or the patients usually come with their donors. But I think that there should be due diligence. Ethically, doctors need to do due diligence before you take someone under the knife. And that was what we saw with the Ekweremadu, the former Deputy Senate President that was sentenced this year. Because what happened was that, of course, the doctors started to interview this donor. And then they found out that you do not have the resources to continue the lifelong care that should be required from someone who has donated his kidney. How will you continue with that? So I think these are questions we need to ask. When someone comes and says he wants to donate his kidney, even if it's altruistic, you need to look at it. What does he have the capacity, the financial capacity to continue with a certain lifestyle after he has donated his kidney? He needs to change his way of life. Of course, he needs to change his diet. He needs to, you need to look at the kind of job he will do. You have to look at all this. All these are encompassing. So I think we need to start to ask these questions. Another thing is we need to create a lot of awareness. People need to know that there is a long-term repercussion. One of the experts we spoke to, said something very vital. He said there's a likelihood that those who have donated their kidneys may also have CKD, that's chronic kidney disease, in future. And then what happens, especially if you're from a poor economic background, what happens to you? You may not have money for dialysis. You may not have 15 million naira for the procedure. And then where do you get a kidney?
Good question. Ms. Sadiq, one of the agents that you discovered is based in Lagos. Did your investigation show that other parts of the country may be involved in this?
I think what we only showed was that this is something that is becoming very common and topical, and it has become a source of concern. We looked at the fact that in the last few months, we know that there was a similar case in Plateau State, in Jos in particular of Plateau State, whereby the case, a suspect is being prosecuted. The case is in court now. So that was the only thing we were able to look at. We didn't really look at other states because it's possible that these things may be happening in other states, or there may be such clandestine operations happening in other states. But our focus for this investigation was around this axis, because this was where we found evidence we needed. This was where we found the testimonies. This was where we found that, and again, the federal capital is where you have very big hospitals, highly reputable hospitals, where you have the high and mighty. So I think also perhaps people need to look into what is happening around Lagos, because we have these top medical centers in big cities, right? So of course, kidney transplantation will take place in usually big cities. So I think I want to put it as a challenge to my colleagues in Lagos. I think we need to look around that area to perhaps there may be something happening.
It's worth mentioning here that you did note that NAPTIP picked up one of the persons that you identified in your report. And the other bit is how we saw the Minister of Health and Coordinating Minister of Social Welfare respond to your report on social media. There were a few things he noted, because at the tail end you talk about, and you've said as much in this conversation, you talk about lapse regulations and policies, but the minister insists that there are policies to guide some of these things. And he also points to the role of state governments who have the power over monitoring of the hospitals. I wonder how you perceive that, his response to your reporting. Do you think it was adequate?
Well, personally, I don't think it was adequate. I agree that we have laws. We have the National Health Act 2014, which we quoted and which criminalizes the organ harvest of anybody under the age of 18. I think a lot of experts have come out to say even the National Health Act is inadequate in terms of this. And also, I felt that more needed to be done, because we found that there is a National Institution Standard Committee, which the minister also mentioned, which is supposed to kind of create standards for hospitals in terms of organ transplantation. And then we found out that since the National Act was signed into law, there was this committee was inaugurated, and then of course the first committee expired, and another one was inaugurated sometime in 2021. But we found out that between 2021 and sometime around November this year, the committee was not active. So, but then with the coming of this present administration, they inaugurated the committee sometime in November. And the committee is headed by a renowned medical doctor, Professor Abiodun Phillips, who we also spoke with, and he told us that, of course, they will look into this. They will do everything possible to ensure that something is done. So I think we're keeping our fingers crossed. We want to see what this committee will do, because we had initially written a freedom of information request to the Ministry of Health, asking them that since there's a committee that is supposed to set standards for hospitals, and we wanted to know what were the standards they were setting for this hospital. We wanted to know how many hospitals in Nigeria had met the criteria for these standards, and we wanted to know the locations of these hospitals. These questions were deliberate, but we never got any response from the ministry. I'm talking about an FOI we wrote sometime in September. We never got a response until we went to press in December.
What responses have you received from the NMA, the MDCN, and the other health associations in Nigeria?
We are yet to receive any response from these associations, but we have received a lot of response from individual medical doctors who were very happy that this thing is in the front burner. Doctors are saying that this is something that needs to be addressed. We're also happy with what NAPTIP is doing, because from the first time we published the first investigation, sometime in August, they reached out to us and they said they were interested, they were worried about this, and they asked if we could help them with some of our contacts, some of our leads, and we did that. And of course, like we indicated in the story, NAPTIP confirmed to us that they've made a lot of arrests, including the broker. And we are happy that they're building a case on this. So I just want to say that as journalists, we have a responsibility. And I think to some extent we have tried to do that. So it is left for now government agencies, regulatory bodies to now take it up from here, to do something about it. Because the fear is that we may not necessarily have a vibrant youth population in future if we allow this to continue. Our youths who are below the age of 25, if they feel the need to sell their kidneys, I think what we're saying is that the number of kidney disease in Nigeria might spike in future, because already experts say we have over 20 million people. So it might spike because anyone who sells one kidney has a higher chance of getting kidney if he doesn't take care of that kidney, because you need to take care of the kidney. So someone from a poor background may not necessarily have the finances to take care of that kidney. He may not eat healthy. So that's just what we're saying. And we hope that the necessary government agencies, establishment, take it up from there and do the right thing.
Ms. Sadiq, a big thank you to you for your time and sharing with us the details of your investigation. We truly appreciate it.
So much.
Lami Sadiq is the reporter behind this Daily Trust investigation that uncovered an illegal kidney trade in Abuja. It's worth mentioning here that Ms. Sadiq was the winner of the Wale Soyinka Center for Investigative Journalism Prize under the category for investigative reporting for print. This particular report won her that award. And we will certainly be bringing you updates out of this, especially by way of government reaction. As you heard from earlier, the Minister of Health has reacted, NAPTIP responded, and hopefully we'll get more reactions as we go.
That's where the interview happens for this week.
This is Now Breakfast